Here are some other questions our viewers have. When will the COVID-19 outbreak peak? When is it likely to peak? How many people are likely to become infected? Well, there's a new report out nationally tonight that is bringing some alarming projections. News 4's Lauren Traeger is digging into that report.
To try to answer some of those questions, we've been asking for predictions from local and state leaders. Well, now there's this interactive tool put together by researchers. It looks at predictions for all of the United States, but also breaks it down state by state. Really pretty eye-opening. And we talked to the researchers who put it together.
All of those factors can change these forecasts up or down.
Dr. Christopher Murray is with the University of Washington in Seattle. He's head of the team that put together the data.
This is a very sobering set of numbers that say there's going to be an enormous number of people needing care.
So let's really dig into this data. This is the page here for the entire United States of America. Now, we've gotten kind of used to hearing about the bell curve when we talk about flattening the curve. This is the range of cases they looked at for projections, this being the low end and this being the high end for the United States. That's the shaded area. But we're going to focus in on the dotted line here. That's sort of their mid-range projections. Again, we're not talking about worst case scenario. We're actually talking about the middle of the road scenario. So taking a look at the United States, this model predicts that around August 3rd, 2020, 81,000 people, more than 81,000, will have died from COVID-19. If you also look at this part of the graph, it says that the peak will happen about April 14th. You can see here on the dotted line, with the number of deaths peaking at more than 2,300 per day. So if I go to the drop-down menu and select the state of Illinois, for example, right here, this has the peak happening in about 19 days on April 15th, and that has the state of Illinois peaking at 91 deaths per day. That would be the peak. Then taking a look at this part of the graph, it says that in August, 2,454 people will have died in the state of Illinois. Now, this data also breaks down hospital resources, and that's where things get a little bit interesting too. This data predicts that on the peak date for Illinois, the state would be short on ICU beds and ventilators. But if I actually go to look at Missouri, the outlook actually gets a little bit more bleak. It says that on our peak day, the state would be short 1,000 ICU beds and we would need about 866 ventilators. Now, that's taking into account what we have right now and if things didn't change. This model predicts that the state of Missouri could experience on the peak day 110 deaths with a total of close to 3,000 deaths by August.
Things will get worse for a while, but if we do stay the course on the social distancing, there is some light at the end of the tunnel.
Experts I talked to say, remember, this is all just a prediction at this point, and of course it depends on a lot of variables, but this study did take into account that we would all continue doing social distancing and abide by stay-at-home orders. They say they're going to update this data daily, and of course we will continue to track the numbers as well. I'm Lauren Traeger, News 4 Investigates.